As you may know, October is Breast Cancer Awareness Month. It is so important that we continue to research and update technology to lower the statistics of those affected by breast cancer. Dr. Lindsay Beakley is here from Providence Breast Surgery. Good morning.
Good morning.
We are so excited you're here, and like we've been talking about all month, it is such an important month to raise awareness for breast cancer. I do want to talk about some of the statistics that we may see and that we may not know of.
So thank you for having me. It is an exciting month, and 1 in 8 women will be affected by breast cancer. So it's really important to have yearly screening and know what those screening guidelines are, because there are several resources out there, whether it's the U.S. Preventative Task Force, the American Academy of Radiology, and we all have a few different recommendations in terms of how women get screened, and that can lead to confusion, not only for the primary care providers who may be sending you for your yearly mammogram, but for the women who are wanting to know, well, what step do I need to take to make sure that I'm screened appropriately?
Right, and a lot of the times you hear stories of women going for their yearly mammogram and then getting that news. So again, it is so important that we as women go and do that yearly. Now, I do want to talk about high risk too.
So there are women who are at a higher than average risk for developing breast cancer, and we can actually identify those women and then put them in a high risk screening program. So rather than getting a mammogram once a year, what we would actually recommend is a mammogram followed by an MRI, and we alternate those two imaging modalities every 6 months. So you still end up getting a mammogram every year, but we're adding to that with an MRI. And so ways that we identify those women who are at higher risk are by risk models. And there are several out there. The one that is supported by the American Society of Breast Surgeons is the Tyrer-Cruzik risk model, based on a little bit of your own history as to whether you've had a breast biopsy before and what the results of that biopsy are, but also identifying people at higher risk based on their family history.
Right. Wow. Well, you know, technology is always changing, and thank goodness in this aspect it is, because we have new technology and new tools that help us in the breast cancer area.
We do. In fact, I'm very excited because Providence Hospital was the first hospital in Mobile to embrace wire-free localization, which is a technique that I used in my fellowship training and have brought to Mobile. So let's say that you go in for a breast biopsy. The radiologist is going to perform the biopsy, and they put a marker into the breast. And I tell patients it's the X marks the spot. We're always going to be able to refer back to that area in the future, whether it's just future screening of that area in the breast or if that area needs to be surgically removed. So what has typically happened is the morning of surgery, if you do need the area removed, you go to the radiology suite, and under mammogram guidance, a wire is placed into the breast. And then you're brought to the operating room, and the wire is like a road map for the surgeon to get to the area that needs to be removed. The wire-free localization gets rid of that need for having a wire placed in the breast the morning of surgery. It also allows me to place the incision in a more cosmetically appealing area. So whether it's underneath the fold of the breast or around the nipple areolar complex, it aids in cosmetic improving your cosmetic result.
Yeah. Wow. Well, it's incredible how technology and just things have changed over the years, especially for the woman undergoing the surgery. It sounds like it is an easier process. So finally, where can people go if they need more information about Providence or whatever information they need? Where can they go?
Right. Providence Hospital actually has a Facebook page, and so since it is October, we've been posting a lot of new updated information, and that would be a great great place to start.
Awesome. Thank you so much for all of that information. Again, you can find all of this at fox10tv.com right under the Studio 10 tab.